Yes, us chiropractors, we definitely treat injuries after a car accident. The most injuries that we see is either neck or lower back pain. We also have pain that stem from extremities, meaning from your shoulder, your elbow, your wrist. It could be your hip, your knee, your ankle, your feet as well. But the majority that we see is either neck pain or lower back pain that stem from a whiplash due to a car accident. And the way a whiplash happens is when there's a force, there's a trauma, and you get hit, let's say from the back, there's a rear end accident, your body gets jerked forward and back, your muscles, ligaments, and tendons get pulled, causing internal damage. Now, sometimes it can be small tears. What we call it's a sprain strain, where the ligaments and tendons are pulling as well. And this causes inflammation, putting pressure on the surrounding nerves, causing the pain that you have. Now, your muscles, ligaments, and tendons are all made up of what we call cells. And these cells require time to heal after an accident. And that's where we come in to make sure that everything is healing properly. Most accidents tend to last an average accident about 6 to 8 weeks of treatment. And during that time, we do both chiropractic treatment and we do physical therapy or physiotherapy, where we allow the cells to heal properly, where you're not left with any long term issues or injuries, and you're not left with any scar tissue due to a whiplash accident. The things that we treat when it comes to chiropractic is what we do a chiropractic adjustment. We actually move the vertebrae doing a high force thrust and put him where it's supposed to be, where we can actually align the vertebrae, where you have seven vertebrae in your neck, you got 12 in your, from your top of your back to your mid back, and you got five for your lower back. We can actually realign the vertebrae, taking the pressure off your nervous system. We also do physical therapy, where we do electrical muscle stimulation, where we put actual electrical muscle stimulation on the surrounding muscles that are injured due to an accident, and this allows for any inflammation if you have or any trigger points. It allows for the inflammation to decrease. It allows for the muscle tension to decrease as well, and it allows for the pain to decrease. We also do ultrasound, where we actually take therapeutic ultrasound waves and we put that on the muscles again or ligaments where or damage due to an accident, and that allows for the cells to realign and to heal properly. We also use heat packs or cryotherapy, meaning cold packs, where we allow that also allows for any muscle tension or inflammation to be healed as well. We also do other treatments such as we do cold laser, where we can shoot laser at a specific frequency to allow the tissues to heal. We do dry needling, which is a treatment where we actually take needles and we place them into the muscles and trigger points due to an accident. That allows the body to heal. It's separate from acupuncture. A lot of people think dry needling is the same thing as acupuncture. Acupuncture follows a meridian system, Chinese meridian system, but with dry needling, we actually put the needles into a specific trigger point. We also do intersegmental traction, where we have traction beds that help pull the vertebrae apart, do the specific movement that they do. This allows for any muscle tensions, again, or any kind of stress that you have on your spine to be relieved. And we also do a treatment with chiropractic for the lower back, where we do flexion distraction. Flexion distraction is great for any disc issues, lower back disc issues, or we also do specific distraction techniques for the neck as well. What happens is after an accident, you can have a disc issue where the disc is herniated or what we call bulge. With flexion distraction, we actually are able to pull the vertebrae apart where the disc is in between and flex it up and down, the spine up and down. And that causes a negative pressure within the disc, creating a vacuum force to allow the disc to kind of pull itself back in. And that really, really helps with any disc herniations after an accident. And we try to do the complete package, where we do both the chiropractic and the physical therapy or physiotherapy to allow the patients to heal. where the chiropractic is more of passive care where we're doing the work, but we try to get our patient to active care, physical therapy as well, where that allows the body to feel to heal twice as fast. And like I said, we start our treatments off on an acute injury about 3 times a week. We reevaluate usually after 4 weeks and decide if the patient needs any more care. We've had great results. We definitely recommend chiropractic after an accident. We were able to get results natural, free of any medicine or any kind of surgical intervention. Obviously, we do refer out if a patient does need surgery. We work with orthopedists and neurologists that we have direct relationship with. So if the patient does need medication or further injections or any further treatment, we actually do refer out as well. That pretty much covers what we do, Haley.